Hi everyone, this is Nomi. It is the 5th of July today, and that makes it 15 days post lumbar surgery for me, lumbar fusion. Um, I mentioned a few days ago that the nerve pain down my left leg has worsened quite significantly, and now I'm getting sort of numbness in my toes quite frequently, and there's a definite weakness in that leg. It started really worrying me, so I spoke to the hospital yesterday morning and they told me to come in and see the surgeon. So I did that yesterday, and he sent me to do an MRI. I'll be having that tomorrow night. Um, and they basically want to, see if they can see a reason for it. He said it could be that there's an infection um, around the site of the operation, and that might be causing, extra pressure on that nerve, and that might explain why it's worsening rather than improving. And I think that that's probably would be the best option. He said he can't rule out that it's not a screw, but misplaced. However, they did do a CAT scan at the end of my operation to make sure that the screws were placed correctly, and then they replaced them so that they were placed correctly. So they ought to be, but he said he can't rule it out. I'm fairly nervous about it. I obviously would be very upset if this turns out to be permanent nerve damage. It's quite significant, the pain, and it makes walking very hard, and I can't sit again. So that's why I'm now lying here. Standing up and walking around is easier than sitting, but my leg is very weak, so I can't do much of that either. So in the meantime, the surgeon has given me a prescription for Lyrica, and it's an anti-seizure medicine that helps with nerve pain. And he wants me to very slowly start with 75 milligrams in the night, and then wait, and then keep adding 75 milligrams in the morning and in the night until I'm at 300 milligrams twice a day. Well, 300 milligrams, 150 twice a day. However, I have done extensive research into this medicine, and it's very scary. I'm really not interested in taking that medicine unless I absolutely have to. Apparently, it can cause horrific side effects. I'm already on antidepressants, and it can cause and worsen depression and cause suicidal thoughts. Causes weight gain, can cause insomnia. It can cause all sorts of horrific things, and you can't just stop taking it. You have to very slowly wean yourself off it. So I've been, deliberating whether or not I should take this medicine because this pain in my leg is significant, and the Percocet is not helping it very much at all. The Percocet is, my back pain from the surgery is actually just over 2 weeks post-op. It's absolutely bearable. I take Percocet 3 times a day, 5 milligrams, and it completely keeps that at a completely bearable level. It's fine. But this nerve pain does not seem to be significantly improved at all by the Percocet, which is quite typical apparently. So I don't want to have to live with this pain forever. But on the other hand, I would rather deal with pain for a while than start on a medicine that is potentially very bad and very difficult to get off once you start taking it. So I think what I've decided to do is wait for the MRI results, and if it turns out that this is a temporary nerve pain, they can see the source, maybe an infection, something, maybe swelling still around the site. If it looks like it will resolve itself, I'm just gonna grit my teeth and I'm gonna bear it. I'm gonna just deal with the pain and wait for it to hopefully pass. But if it looks like this is permanent nerve damage and I'm gonna have to contend with this pain forever, I guess I'll have to try the Lyrica, however you pronounce it. Um, and it would be worthwhile because there are people who swear by it, who say that it's given them significant pain relief um, where nothing else did. But there are many, many people who talk about very severe side effects. So I will let you know what's happening with that. You know, if I really hope to be able to tell you that that it isn't permanent, this nerve pain, and then I won't take the Lyrica. And if it looks like it's going to stick around, I'll start taking it and I'll tell you if I have those side effects or if it's actually helping me. Um, so I'll update you soon on all of that. I'll let you know after the MRI what the surgeon says. Um, till then, look after yourselves. It's kind of depressing. I don't regret doing this operation yet because at the moment, one sec. At the moment, sorry, my daughter just walked in. At the moment, I am finding relief in my initial back pain. I still have the achy pain from the surgery, but I am able to lie flat in my bed, which I couldn't do, as I mentioned, for a long time. I have less back pain than I had before, um, or at least it's less severe than it was when it was flaring up really badly before I had the surgery. However, this sciatica pain is it's worse than I had before the surgery. Before the surgery, I had sciatica pain that came and went. It wasn't a constant, but when I did have it, it wasn't as severe as this, and it didn't make my leg feel weak. And that's really troubling because I'm really hoping to be able to go back to a good exercise routine and get myself back in shape. I haven't been able to exercise in really for the last 2 years. I've hardly managed to exercise, and I really want to get into shape. So, having a nerve problem that has given me this leg weakness is really troubling, and hopefully it will be temporary. So I'll let you know what they say after the MRI scan, and I'll speak to you then. Take care.